This video will prepare you for what to expect during your hospital stay. Remember, nothing to eat or drink after midnight the night before your surgery. You may have a small sip of water with medications as directed. When you arrive to the hospital, call the phone number you were given to be escorted to the surgical area. The surgical holding room is a long rectangular room where you will get changed and begin to prepare for your surgery. You will have a nurse taking care of you. You will have an ID band on with all of your information, like your name, your date of birth. Everyone will be checking that band. Also, it may seem annoying that many people will ask you for your name, your date of birth, and what surgery you are having. Please bear with us. It is not that we don't communicate with one another. It is one of the many checks that we have in place for your safety. Your safety is our number one priority. You will roll out of the holding room on your stretcher to the operating room. There they will get you into the operating room table and get you ready for your surgery. Again, for your safety, a timeout will happen. Before your surgery can begin, everyone in the operating room must stop and face one another at the center. Then they all must agree that this is the patient that they expect to have in the room, that they are doing either a hip or a knee replacement, and that they are doing a right or a left. If not every single person agrees, they must step back and go through their checklists again. Please feel confident that you will get the surgery that you are expecting. You will roll out of the operating room on your stretcher and directly into the PACU. There, a nurse will be caring for you. You will have a monitor with leads attached to your chest to monitor your heart rate. You will have oxygen on and a monitor on your finger to check your oxygen levels. Here you will slowly awaken and prepare to transition to the next level of care, the orthopedic floor. On occasion, there may be a reason that you would need to be monitored specifically for heart or breathing issues, and you may be transferred to a specific monitoring unit. Your safety is very important to us. The staff will always assist you for anything that you need. Please use your call light for anything. We know that people worry about bothering us. You are choosing to have your surgery at Signature Healthcare, and we are happy to respond to your call. Also, do not be concerned about pulling your nurse away from an important activity. Anyone can answer a call light. Most of the requests are easy enough for anyone to help with, for example, moving an item closer. If it's more complicated, we can bring the request to a specific person if needed. After surgery, anesthesia and the post-op pain medication can make you feel fuzzy and make it difficult to remember information clearly. We will be getting you up out of bed on the day of your surgery. We will give you all the details in the next few slides. We have big comfy chairs for you to spend a good deal of time out of bed. They are right next to the bed, and sometimes you may be tempted to get back to bed on your own. Please don't. You will have things attached to you, like an IV, and the table in front of you is on wheels. You will be at a huge risk to fall. Use your call light, please. We will remind you. The knee is the largest joint in the body, and the hip is the second largest. When these joints are invaded by surgery, there will be swelling. There is a lot of hammering, chiseling, and moving around of the joint during surgery. Together, these activities will lead to a typical post-operative pain. The pain you are having before surgery, the pain leading you to have a joint replacement, is not going to get any better, and likely will get worse over time. After surgery, the difference in your pain is that it will get better each day. The painful bone ends are gone. We will use multiple methods to control your post-operative pain. Medication is just one part of the plan. Repositioning. This is why we get you up and moving on the day of surgery. The motion of the joint and getting up and using it is one of the most important steps. Ice is important to use while at rest and when you get home as well, to control swelling and improve pain. Distraction. Bring a good paper book or puzzle book to take your mind off being in the hospital and the times when you are sitting in your bedside chair. All these things help us to manage your discomfort. See the yellow pain scale? We will be asking you to rate the level of your pain on a 0 to 10 scale. 0 is no pain. 10 is I slammed my fingers in the car door, the car drove away with me hanging on, and there is a lion chewing on my leg. It is important to be honest so it can drive the best care plan for you. Cold therapy is used after surgery to control swelling and pain. If you are having a knee replacement, the polar cube on the left will be attached to the wrap as demonstrated in the left and center pictures. The cube cooler will be filled with ice and water, which circulates the cold through the wrap and the warmed water back to the cooler. It will need to be refreshed with ice. The staff will be happy to do this. If we don't remember to offer, please just ask. If you are having a hip replacement, we use the good old ice bag. It conforms well to the area. This too will need to be refreshed. Ask if we do not remember to offer. The cryo cuff will go home with you, but the polar cube will not. You may be able to borrow one or purchase one online. Old-fashioned ice works well too. Physical therapy and occupational therapy will begin to start your therapy on the day of surgery. We will bring in a walker with wheels to start. You will be weight-bearing as tolerated, which is encouraged to help with the healing process. We will do what you can tolerate on this visit. Everyone responds to surgery differently. You may just tolerate getting up to the chair or to the bathroom, or you may take a long walk. Some patients even do stairs on this visit. Education will be ongoing. You will receive helpful hints, packets, and home exercise program, as well as posterior hip precautions if applicable. Ice, as we have already described, will be refreshed as you need it. The next day, physical therapy will see you twice a day, and occupational therapy will see you once a day, usually in the morning. We will continue to work on bed mobility, transfers, walking, and exercise. All patients will be out of bed to the bathroom with staff and out of bed for meals as tolerated. Everyone starts with a rolling walker. If you would like to try crutches and you are safe with a rolling walker, we will try, but you will go home with the device that you are safest with. We will also progress to stair training. We will not begin until we believe that you can successfully negotiate at least a few stairs. You will have 2 therapists for initial stair training so that you can have the confidence to try. Starting this day, we expect you to be out of bed with help for all meals and to walk to and from the bathroom with the nursing staff using a rolling walker. Occupational therapy works with you on activities of daily living, or ADLs. These include dressing, bathing, and toileting. Some patients may find these activities challenging after surgery, and some patients will have hip precautions to follow after surgery. The occupational therapist will bring in some adaptive equipment, such as a reacher, sock aid, and long-handled shoehorn, and allow you to practice. So it is important to bring in loose-fitting clothes and practical shoes. Do not wear high heels, boots, or tight-fitting clothes. It will be difficult to put them on and to ambulate safely with after your surgery. Some of the equipment you may need after surgery is pictured here. Everyone will use either a rolling walker or crutches, depending on which is safer for you. If you have gotten a walker in the last 5 years, insurance will not pay for another. You will need to find it, borrow one, or purchase another. Otherwise, we will provide the walker or crutches, not both, and the durable medical equipment company will bill your insurance. Insurance does not cover the hip kit and no longer covers a commode. Borrowing these items or finding them online to purchase are 2 options to assure that you have what you need when you go home. If your hip replacement is being done with a posterior approach, you will wake up in the recovery room with this spongy blue wedge between your legs. Don't worry, it's meant to be there after surgery to help with positioning and to help abide by the hip precautions you will need to follow. You will get information on these precautions. It is only needed in bed and in the initial post-op period, but makes a handy and comfortable positioner for at home. On the day of discharge, we will review any activity that you feel you need to review. Stairs, exercises, hip precautions. We will make sure that all your questions are answered prior to leaving. Nursing will also give you verbal and detailed printed instructions prior to your discharge. It may be helpful to have your support person listen to these instructions as well. Most patients return home with visiting nurse services, which will be set up by case management prior to your discharge. Nursing to monitor your medical needs, physical therapy to continue to advance your mobility and exercises, occupational therapy if the OTs in the hospital feel that you could benefit from further training. These professionals will contact you to arrange a mutually agreed upon time for their visit. Therapy usually visits 2 to 3 times each week. You will be followed up through your first post-op appointment with orthopedics. Then you may transition to outpatient therapy if needed. 100% of patients undergoing a total knee replacement will continue to outpatient therapy. There you will progress your range of motion and strength as well as move to a cane and eventually no device. About 50% or so of patients with a hip replacement will need continued outpatient therapy, mostly to improve your walking pattern and strength. Our surgeons do prefer you to stay within our system. They know us and we share our medical records so that we can see your progress well. Signature has 4 locations that are listed here.